This is the Power Seat, joined by Dr. Judey, and she's going to be chatting to us about all things in the STEM world. Good evening, Dr. Judey. How are you doing?
Good evening, and good evening to all the listeners and viewers.
Thank you so much. How is your evening going? Are you settled? Are you ready?
Settled, I'm ready. I'm here to give my whole academic background and all the decisions that led up to all of this.
We're here for it. This is the best way to settle into, of course, a Monday evening. Now, Dr. Judey, let's talk about you as a biomedical scientist and a product specialist. What was the thing that made you fall in love with this line of studies and, of course, a profession?
Now, the first thing that I'm going to tell you as a young person, and I'm referring to when I was 17 and 18 years old, when I was kind of forced into a direction to make a decision. I didn't have the answers then. However, I did know that I had a natural affinity toward biological sciences and chemical sciences and so forth. So although I didn't know exactly which address to go to in terms of what I wanted to study, I just knew that I need to go in a biological and a scientific direction. And when I started my academic career, yes, it was in biological sciences, chemistry, biochemistry, genetics, and eventually pharmaceutical chemistry. I grew into it. And when I started my career at first, I thought, my passion is only pharmaceutical science. I'm only going to go in drug development and design, design new medicines for all sorts of diseases. And I thought, this is why I was placed on the earth, is to do exactly that. But I had a teachable spirit, I was open-minded to new things. And this is what I also like to encourage this, to especially the younger listeners, is that be open-minded, because then it led me to what we call tissue engineering, where we worked with burns patients, and the best plaster that you can give someone who has a wound, like a burn wound, for instance, is their own skin back. So I went into tissue engineering, where we literally cultured skin cells and we placed it on a matrix, and it was then given to patients that we call cellular epithelial autografts. So we made skin transplants for burns patients here in South Africa. And that ultimately led me to, but now you heal the wound at least, but now how do you rehabilitate the skin? How do you reduce the inflammation on the skin and prevent any form of hypertrophic and keloid scarring from forming? And that actually led to me going into cosmetic direction, So now I'm in the cosmetic direction, and we're applying topical products, and one thing led to the other. And yes, although it's pharmaceutical and wound care, but I can also tell you I'm in the anti-aging space. I'm in the helping people with acne and sensitive skin and these type of things, even scalp treatments. So it was literally one thing that led to another, because I had a teachable spirit. But all these things remain under the umbrella of biomedical sciences.
I tell you, an absolute mouthful there, Dr. Judey. But I love that thread of saying a teachable spirit. Now, I think in line with that teachable spirit, I think let's simplify this for us. The layman here. Your work focuses a lot, as you mentioned, on wound healing as well as regenerative medicine. Now, can you explain in simple terms, why this particular field, right, would be important not only just to the South African market or healthcare system, but also the continent?
Well, the thing is, especially now during winter, although we're having a good winter season this year, but winter is typically known for the burn season. And you'll be surprised how many people burn. And about 3.2% of the South African population, and we can take that onto the African continent as well, individuals burn with either paraffin burns, and the most popular burn is typically a hot water burn. And usually the burns patients are all children under the age of 10 years old.
Sure.
Now, I don't know how you feel, but if you see a child that has a wound like that, really struggles, especially full body surface wounds and so forth, it is difficult to, how can I say, walk away and not let something like that affect you. And yes, the only thing that, children are so sensitive and are so vulnerable, so that they don't want to be exposed to severe wound dressing changes, because that all in its own is very stressful and painful. So where regenerative medicine comes in is where we facilitate the process either with topical wound care products or secondary dressings, for instance, that can be given to these individuals that, how can I say, guide the body itself to regenerate brand new tissue so that we can get to a state of overall homeostasis and equilibrium, so the body just heals much more faster.
Yeah.
So we try to reduce the stress component in the healing process, and we facilitate healing at an optimal level. And on a continent like ours, I mean, not everybody is exposed to the best healthcare system. There are waiting lists for certain individuals. I mean, certain wounds need to be debrided, needs theater time. There's no such thing. There's no such a luxury. So if you actually can design product or even dressings that can be given to families, especially in rural areas, you'll be surprised how much you can do with very, very little.
Speaking here with Dr. Judey, a distinguished biomedical scientist, and she is on our power seat. Now, Dr. Judey, I mean, I think that is such again, it's Africans being solution driven and being creative because of our environments and what we need. Now, let's speak to the importance of the STEM careers. And perhaps this question is going to be a two-part question. Are you first seeing a growing interest among young people in South Africa and the continent towards STEM careers right now? And also, why do you believe that STEM skills are becoming increasingly valuable in today's economy?
There's definitely an increase. I mean, there are certain universities that's only leading toward a very particular direction. We call it specialized education, that actually only focus on STEM careers. And the reason why is because on the African continent, we have very complex problems, and we want solutions to those problems, and never ever underestimate what we as humans can do. And I'm going to give you an example. One of the complex problems we have on the African continent, but very specifically South Africa, is we had the highest HIV rates in the world. And because of that, it kind of forced us into a direction we had to refine the type of research and development that we need to do in drug discovery for HIV. So you'll be surprised that the type of research output that comes from South Africa and HIV is most probably the best on the planet. Purely because we had to find a solution. And yes, it's also STEM careers are one of those careers, although some would debate with me, but it's not really a discipline that can be grabbed by AI. It still requires that human intervention. It still requires that human thinking. It still requires that, that human touch and that engagement. So it's not really a career or careers that can be grabbed by AI, and there's all sorts of diagnostic tools that can be taken over. So is there an increase? Without a doubt, there's an increase, because we here in South Africa and on the African continent, we have complex problems, but we've also proven categorically and explicitly we can provide those solutions. We can provide solutions for these complex problems. We can be innovative, and it's as if it motivates us. It's a discipline that makes us feel we want to get involved, we want to make a change, and not only is it good for our academic growth, but our economy growth as well.
Yes, the voice there of Dr. Judey. She is a distinguished biomedical scientist. Now, Dr. Judey, as we wrap up, and I still had so many questions for you, I want to speak to the part of you that is, of course, an entrepreneur within the space. And of course, we've known and we hear the conversation and it continues and it personalizes itself in different ways where we speak to job creation. Now, can science-based entrepreneurs contribute to job creation? And then also, what opportunities are there for young people entering the space as an opportunity for them not just to be professionals, but also to then be entrepreneurs within the space?
Absolutely. The first thing that I would say, as an entrepreneur, you should try to encourage or to provide an area in the workspace for internship programs. And some of these internship programs doesn't necessarily have to be a whole year. It can be anything between 3 months to 6 months, where you bring in young people and you expose them to the hustle and bustle of, what happens in the private sector and even the academic sector as well. And internship programs is not necessarily something that's really that costly, because sometimes entrepreneurs feels like, oh yes, I cannot afford another salary. The salary bill is already so high. But there is some cost-effective ways to look at internship programs that can benefit both the entrepreneur, the business owner, as well as the young person who comes into a workforce and physically see how things are done. Not only, say, for instance, in a laboratory environment or the actual workspace, but even some other channels, like what type of marketing is necessary, what type of logistic factors are necessary in a discipline of a particular nature. And then, yes, entrepreneurs should never forget they should become mentors, and this is how I see myself as well. What we lack in South Africa and on the African continent, and quite frankly, probably worldwide, is good mentorship programs. And we should do mentors or be mentors more to young people so they feel safer. They don't always have all of the answers and so forth, but be a mentor for young people. Expose yourself, so that they can learn more from you. And then on the flip side of young people, and I would like to maybe say the Gen Z generation, the younger folks, sometimes you feel like, oh, I'm not in the mood for working. I'm not in the mood to listen to someone. But be open-minded and know that usually your 20s is not supposed to be a comfortable stage in your life. It's a decade that you should hustle, you should struggle, you should gain experience as much as you possibly can, and just expose yourself to new learning.
I mean, Dr. Judey, you took the words out of my mouth, because I was about to ask, what words of advice would you have for university students? And I don't think you have, there's anything more required from what you stated there. But perhaps in closing this conversation, perhaps let me ask you, what is your vision when you sit with all the work that you've done? And I can hear the passion, like in your voice when you speak. That's not just a profession for you. And I guess you go back to that 17-year-old girl, that it's so much more for you. It is a calling. What vision do you have for the future of STEM, in particularly in South Africa as well as the continent, and what impact do you hope to have on the next generation of scientists?
What vision I have for myself and my company is, and I feel I will only have that contentment once I reach that point, is most of the skincare products, and I'm referring to not only cosmetic products, but pharmaceutical products and medical device topical products, are very dominant north of the equator. So even here in South Africa, we typically only like to buy skincare products that come north of the equator, because it makes us feel safe and it makes it feel trustworthy. But I just feel I would like to do everything that I possibly can, from a statutory component, from a quality component, from a safety and efficacy component, to get a skincare brand, a dermatology application that's the most powerful, that comes south of the equator, that's what I feel is the hunger that I have in my heart and the dream that I'm chasing here. And from my side, my last words is remain curious all of the time, and never ever this drive that you have, this natural drive, never put out that fire. There will always be stuff and obstruction and obstacles in your way. That's no problem. Just tackle it and continue. Get up 7 times 70, but just continue.
Oh, the voice there of Dr. Judey. When that brand that you're talking about is finally ready, I'm here, putting up my hand to say I'm here to advocate for that. Thank you so much. The voice there of Dr. Judey, who is a distinguished biomedical scientist and an entrepreneur within the STEM environment. And of course, her parting shots were, never give up. Let that fire keep on burning in you as a young South African, as a young Zimbabwean, a young Botswana, a young Nigeria, wherever you are, Nigerian across the continent. Let that fire continue to burn. Stay curious, fall 7 times, and make sure that you rise 8 times.